Hi guys, this video is about a placement I did last year, my first year. Um, it was called the Health Facilitation Service, so I'm going to talk to you a bit about what that is in a minute, but I just want to explain why I feel I want to make this video first. Um, you don't really tend to work in a hospital in the same way you think an adult nurse might work in a hospital as a learning disabilities nurse. Obviously, if you're in a ward on a hospital, you as a learning disability nurse possess skills to support people with learning disabilities. But if you're in a hospital ward, in an ordinary hospital, you can't always guarantee that you're going to be working with people with disabilities. You could be on a ward and not see someone with a disability for weeks. So your skills that you've learned are not really put to great use there if you're not using them to your full advantage. Um, that doesn't mean that you don't work in hospitals. You can go on to do that. Part of the health facilitation team's job is to support people in that environment. My role in my first year, I was based in an office. There are four teams across Birmingham, north, east, south, and west, and they each cover a nearby hospital. So I was based at one of the bases, obviously, and my job was every day I had to ring the wards of the nearby hospital and see if anyone with a learning disability had been admitted. I know if it was a no, they just say no and I put the phone down. Then if it was a yes, I would accept the referral. I would tell my mentor that I picked up a referral, and then we would go to the hospital. Um, our job there is obviously to make sure that that person is okay. We also have to make sure the staff on the ward supporting that person are aware of their needs. They know how to communicate with them. Some people would have their family with them, so that wasn't as much of an issue. The family would be there to support the staff with any sort of communication barriers or behavioural issues, etc. But sometimes they were people on their own, so the staff, perhaps they have no experience, or they have very little experience of working with people with disabilities, so they might be a bit apprehensive about how to help that person. So it's good that health facilitation could be there to sort of educate the staff and also at the same time make the service user in hospital feel at ease with the treatment they're getting. Um, I was there for 4 weeks, and that was really good. It didn't just involve going to hospitals, but that was something I went to the hospital about 2 or 3 times a week out of a period of 4 weeks. That was cool. Obviously, it depended on, sometimes I'd do a sweep of all the wards and there'd be no one new, but there was sometimes other people would be there for a few days, and if we'd seen them yesterday, we didn't need to go and see them again. But we would check on them every couple of days, and sometimes I would just ring up and say, "Oh, how is that person doing, by the way?" And I get a handover from the staff on the ward. Um, so yeah, I mean, it was pretty cool. I mean, towards the end, I was made case manager with a joint case manager with my mentor. So I was the one making all the phone calls, doing the visits, doing the assessments in hospital. But then obviously my patient was only 4 weeks, so I had to leave at the end, and then I had to hand over the case back onto my mentor. And I don't know, unfortunately, I don't know what happened, with the cases I was given. So yeah, I mean, I just wanted to, I've before I started my training, I didn't think that LD nurses worked in hospitals. I thought it was out in the community. And when I started my training last year, in the induction week of first year, they said, "Oh, LD nurses don't get uniforms because you don't go to hospitals." And there and then, that didn't bother me at all because I knew I didn't want to take my degree to a hospital environment. I wanted to be out there in the community. But then, obviously, having that experience in the hospital, it made me realise that all the people that have said, "Oh, LD nurses don't work in hospitals," it isn't true because you can do. And it's a really important job. If you're aware of reports like Deaf by Indifference, that unfortunately the history of people with disabilities in hospital isn't great. Sometimes they have really poor treatment and they do die or get seriously ill. Really, silly reasons like not nutritional reasons, like not being fed, not being allowed to drink, not given pain relief. Having do not resuscitate orders on the patient just because they've got an LD, not for any other reason. So it's things like that that make us need to exist. If the history of the treatment of elderly people with disabilities was not what it is, then perhaps LD nurses wouldn't need to exist. But the fact that the history is what it is why we are here and why we are needed and always will be. And I'm going to be one of them next year, so bring it on. Yeah. that was my first placement really, so that was really cool. I passed that, and it was such a good experience to get that so early in my training. Like my first placement, I was the only one that was there. A few of my friends were in residential and day centres and schools, but I felt so lucky to have experienced that so early in my training, and it really inspired me to want to carry on what I was doing and do well. And I was going across the community. I worked with different professionals like speech and language therapists, physios, OTs, dietitians, social workers. I saw all this, the experience so much in 4 weeks. It was really packed, really packed, really a lot to do. I know in your third year you can request your final placement. Obviously, that depends on the demand and if there's a qualified mentor available to work with you. But if that's the case, I'd like to go back there for my final placement, 12-week management placement. So I know that my mentor told me then that if I was to come back, I'll be very independent. Obviously, when you're working on your placement, you're in your first year pretty much glued to your mentor, and then you gradually get weaned off. Because obviously, at the end of your third year, you can't still be glued to them, because then suddenly you'll be qualified on your own. So it needs to be a gradual process. But my mentor at health facilitation told me that in the third year, I'd be independent. I'd be going to the hospital by myself, doing all the hospital visits, doing all the assessments. The only thing I won't be able to do by myself is do home visits. So yeah, that's really cool. So I might, obviously, if something new happens on placement, I might change that and might want to go somewhere else. But currently that's how I'm feeling. So we'll see. But anyway, yeah, that's it really. So LD nurses can work in hospitals. Okay. So I just wanted to make that message loud and clear. But I'll head off for now. Okay. So bye.